Good afternoon, and thanks for watching this episode of Ask the Doctors on Whitewater Community Television's WGTV Channel 11. I'm Eric Marsh, Executive Director of Whitewater Community Television. Glad you're able to join us we've been doing this a while, gentlemen.
Yes.
I went back, March 27th was the first one of these. We've been at this for a while.
You said 1 week, Eric, and here we are.
Okay, I lied. I'm sorry. Dr. Thomas Huth, Vice President of Medical Affairs with Reed Health, Dr. David Jetmore, Wayne County Health Officer. They have been here a number of weeks providing great community service, answering your questions, answering my questions. And that's what we're here to do today. We're here to ask the doctors questions and try to get your questions answered about what's going on with the pandemic and COVID-19 in our area. As we do at the beginning of every show, let's start by, I think I went this way last week, so I'll go this way this week, and find out what is new this week, because as everything goes on, we hear something new. I think Pfizer came out with some information. I don't know that the numbers have necessarily gotten any better. Everybody still has their orange crayon here in Wayne County, which is better than having the red one, but we'd still rather be going in the other direction, I think.
Well, I think one of the things that's of interest is the fact that the governor had a press conference this week and we can forget about stage 5. We're just going to go by the counting color coding. The lowest risk is blue, of which I don't think any county in Indiana has that color now. And then the next level is yellow, and then orange, and then red. And these levels are determined by the amount of cases per 100,000 population, and by the positivity rate. You're assigned a score, 1, 2, and 3, and we are at 2.5. What the governor has said, that if you're in level orange, we can't have gatherings of more than 50 people. If you're in level red, there can't be a gathering of more than 25 people. And he also emphasized that businesses need to post signs that masks need to be worn, and they need to enforce this with their patrons. I think that's something that needed to be done, because these gatherings, Christine pointed out this morning when I talked to her, when we went down, when we were at about 10% positivity, and the mayor and the commissioners mandated that we couldn't have more than 75 people gather, and we saw our positivity rate fall to around 7% after a period of time had elapsed, and I think the two things are related. We had another death today, a woman in her 70s. She was not a long-term care resident. At our testing site, from Monday through Thursday, we've tested 1,037 people at our Elder Beerman site. And it used to be, when we saw people, they were coming in they were curious of whether or not they had the disease and were asymptomatic. They were wanting to be tested. But now the majority of people are symptomatic. I mean, that's what's brought them to the clinic. Our Optum site, over that same 4-day period, had tested 234 people. We still have National Guard, 3 guardsmen helping us, and as long as we have that help, we hope when the weather's suitable for this to be able to do drive-through testing, which is great for both the people being tested and for us, the people are not, you're being confined in your car, you're not having to mingle, even though people are safely spaced inside a building. So you can go, if you go to the Elder Beerman building, this has been said before, if you go in the south entrance, that's for flu shots, and you can get a flu shot there. If you go in the 6th Street entrance, which is to the west, then that's where the COVID testing takes place. We've had a couple of outbreaks at long-term care facilities. I've had some questions, several questions about what are the schools going to do? Are the schools going to close? I know, and I think some of this is prompted by the fact that in Marion County, where Indianapolis is,
Right.
they're going to close their schools from Thanksgiving until the first of the year. And locally, the schools have kind of had the credo that if 20% of the students are absent, then the schools should be closed. And we have had that many students gone at one time or another, but it's not because they've been sick. It's because they've been contacts and they've been asked to stay home. The transmission within the schools is still really, really low. The children that have contacted COVID are almost all incidents where they contacted it outside the classroom. So the positivity rate in the county is 7%, and it's trending downward. The positivity for the state is right at 10%, so we're doing better than the state, but we're not. I noticed the other day that they were panicked in New Jersey because their positivity rate was edging upward toward 3%. Here we're talking about 9, 10, 11, double-digit percentages. So,
But New Jersey was hit harder earlier, so
yeah.
they're really trying not to get back to where they were.
yeah, and I think once you've been through something like that, of course we've just seen the pictures and the news coverage of that, but that was a horrible time for them, and hopefully they won't go back to it. Hopefully we won't experience that.
Okay. You all are seeing some of it because within your facility, you're living it every day, having to do some of what we've seen on television, where hospitals have had to take areas that aren't really rooms, create rooms, move people around. Talk about what you all are seeing and what you're doing.
Well, that's exactly what we're doing right now. We're doing everything we can to try to prevent having to actually reduce services, because we know from the experience in the spring that, delaying things is not good for people either. There are a number of consequences to that. We want to try to avoid that this particular surge. But so we've taken a large meeting hall and 3 connected conference rooms, turned those into low acuity patient care space so that we can move some people from the tower into those spaces for their care, and then use more of the tower hospital beds for COVID patients. Once those, I think we're creating in the neighborhood of 30 beds that way, and once those are filled up, I don't know where we go from there. We're pretty much out of ideas about where to cobble space that can be utilized for patient care, and so we'll have to consider reducing some services of some sort, maybe starting with some elective procedures. I don't know. I'm not, we will do what seems best at the time when it comes, but those are the things that are on kind of the surge plan, as we call it, about, okay, this step, then that step, then the other, and that's all written out in a part of our pandemic response plan. So it is a challenging time, and but I always like to make the point that there are differences from now and this spring. In the spring, everybody knows, or you will remember, that there were a lot of challenges with getting adequate amounts of PPE, and we were very concerned about whether we'd have enough respirators, and we actually bought several additional respirators. This time around, the PPE and technical things are not an issue. Technical things like respirators and other supportive equipment, those are not the issues. But what is an issue is space and staffing. Reed, even if we weren't dealing with COVID, we've had for a while a certain number of open, like, nursing positions in the 20s, and those can be challenging to fill because nurses are in short supply and they're in high demand everywhere. And so recruiting to those positions is challenging, can take a while. So in addition to being kind of short-staffed, we're now kind of expanding the higher acuity care areas, and that means the people that we do have to pull extra shifts, and there's some mandatory overtime and so forth. We're incentivizing that with sort of extra overtime pay differential, so that people will feel that they're at least getting some recognition for the additional work. And but I think there's also a sense of shared purpose and mission that those folks have right now. They feel like they're doing some good in the world, and being there for the community when the chips are kind of down and they're really needed badly, and a camaraderie around that, which is good to see. But eventually there will be exhaustion and burnout that comes along with that. And so hopefully they will get over the hump and things will trend down before that becomes an issue. We are told not to expect things like the National Guard to come in. The National Guard is actually fully committed with other pandemic-related responsibilities around the state. They are currently tasked with assisting with testing sites and going in to assist nursing homes with training and some of the duties that they can perform. Many of the National Guard soldiers are not clinically trained, but they can do things like screen people at the door and answer the phones and stuff like that, and free up nursing home staff to do more direct patient care. So many of the harder hit nursing homes around the state have National Guardsmen deployed to them currently and have had them for up to a couple of weeks. They will, by the end of next week, I think I was told, have National Guard troops in virtually every long-term care facility in this state, and that will include here in the Richmond area. And but the point is, we really can't rely on that for the hospital's purposes. Mm-hmm. And so we'll have to be creative about, how can we gain some extra staffing. There is a healthcare reserve workforce registry that the State Department of Health has maintained, and they're putting out a new call for people to register for that. So that's for people like, recent retirees in any kind of healthcare role, or people who only work part-time and have some ability to spend extra time. Mm-hmm. Or maybe somebody will have a short block of time, a few weeks, that they can come out and devote to doing things. That's people like, there are some doctors and nurses, but there are also people like physical therapists and pharmacists and dentists and the like. So there's a great variety of folks on that. But the state is refreshing that list and is going to make it available to the hospitals to perhaps tap into to help with some of the workforce needs. At the end of the day, what we really need is for things to get better and come down. And I was thinking today about how to characterize that. We sort of, at Reed, we're not unlike many places, and other hospitals in the state are getting to this point. I think of it as a dam that can be filled to a certain point before things spill over. And so you either have to reduce the water going into the dam or find a way to siphon off the water that's in the dam, and applying that to the healthcare setting. What we need fundamentally is to reduce the water going into the dam by doing the things that we know help to reduce the spread, and more people need to embrace that. But in addition to that, things like vaccination, which we can talk about some today. We believe that we'll have some vaccines soon, and monoclonal antibody may actually help with the hospital volumes problem. We could talk about why that would be the case. Would help with the pressure into the dam, but we probably need also to look at creative ways to relieve the pressure off the dam by draining it, and that's that would be characterized by being able to move people who still need nursing support into other modes of care or means of providing that care, but outside the hospital. Maybe it's at nursing facilities, maybe it's with home care, maybe it's in other ways. You know, a particular problem, just as an example, with COVID patients particularly, is that once they begin to get better and don't need so much acute hospital care, there really is, but they can't really go home yet. There isn't really any place to send them because we don't want actively contagious COVID patients in long-term care settings. That's been tried in other places, and it's a disaster. So, you know, most long-term care facilities will not be able to take on those patients until they're at least 10 days past the time of their first symptoms, because that's when we know the contagiousness drops off to a negligible level. At least that's got to happen, which means in the absence of some place to send patients to, they have to stay right where they are. And we don't have much choice about that. So I think we have to get more creative about are there ways that we can create avenues for them to continue to get the level of support that they need, but outside the acute care hospitals, so that we can utilize that space more efficiently.
You're watching Ask the Doctors on WGTV Channel 11, and you can do that. You can, if you have a question for our doctors, you can send us a question on our Facebook page. You can also send us a question through Twitter at WCTV Info. Before we start to go to some questions, and there's some left over from last week, and then we'll continue to go. You mentioned vaccines. I know that you all watch that very carefully. Every week there's new information to come out. I think it was Pfizer that made the big news this week that it looks like they have something that could be pretty effective, but also in listening, it sounds like that's still kind of early in their trials, and that's still not something that's going to be released next week. Where are we standing in terms of vaccines? Because health departments have to be ready to get it out there. What are you all hearing as far as when you might be able to see something? And obviously, the general public won't see it first. I think
that's
doctors
true.
and first responders will see it first.
Well, first of all, on the 90% effectiveness thing, that's extremely good news. You know, much better than we get typically with even flu vaccine. And we know the flu vaccine helps to reduce the spread in the community, even when you have the flu vaccine is a very special case in any given year. The effectiveness rate can range between only 30% up to maybe in a great year 60% or so. And at 90%, this coronavirus vaccine, that's amazingly good, far in excess, I think, of what any of us were really expecting to be the case. And so that's very exciting, and that's what really generated the news. Now, you have to marry that up with, which I think is even better news about it, they vaccinated over 40,000 people and had zero serious adverse events. And, you know, of course, that's the thing that people worry about with, you know, am I a guinea pig here? And I would say this and other vaccines that are under development, you know, by now, well over 100,000 people have been vaccinated with one or another. And the newer vaccines all use a newer technology that involves mRNA, which I can't explain, so don't, you know, in detail, but it's a newer technology for vaccine development. And so many people have been vaccinated with it now. I think it's the professionals, the public health professionals, the virology and epidemiology professionals are actually very impressed with how low the side effect profile of these things are. Now, it's not zero, and I think that people who get the vaccine can expect to have some of the things that we sometimes see with even flu vaccine, with headache and feeling sluggish, whatnot, for a day or two. I had a shingles shot about 6 weeks ago, and I was under the weather for a day, but then I was better. And I had a headache and felt really tired, and I think that's the sort of thing that we can expect to see possibly from this COVID-19 vaccine. But what is even more exciting than all of that, the safety is almost certainly very good, looking more and more that that's the case. The effectiveness is exceeding what we thought might be the case, at least in this early data. But even more exciting is we will physically have vaccine in this county very soon. The state has had previously contracted with Pfizer to provide the state a certain number of doses of vaccine. I've heard the number is approximately 100,000 is what the state's going to receive as its very initial delivery. And then those are going to be distributed to certain particularly designated hospitals around the state, 47 of them the last time I heard a number. And Reed is one of those. We will be responsible for distributing a small percentage of that, about 2%, 2.2%, to the first wave targeted populations in the 5 counties from Randolph County in the north to Franklin County in the south, plus Fayette County, and obviously Wayne County as well. So, we are in the process now kind of setting up the system, how we're going to do this, trying to get some numbers around how many people we're talking about. But the initial targeted groups are going to be healthcare workers, particularly in long-term care facilities, but also those who work in hospitals in containment areas like the ones that we have, people who work in emergency departments, urgent cares. I was told this morning that school nurses are to be added to the 1A list. It's called Phase 1A distribution, and possibly EMS. We're still finding more detail and working out, how far can we actually go with these 2,000 or so doses that we will have, and setting up a system to do that. But we know that we expect to receive it very soon. We have acquired a freezer capable of storing it. All of these mRNA vaccines require one or another level of freezer storage. All of them except one of the vaccines that are on the horizon in the near term require ultra low temperatures, minus 70 centigrade, plus or minus 15 degrees. Your typical medical freezer is not capable of that. So we have acquired a freezer that's being delivered today and requires special wiring. That's going to be connected today or tomorrow. And then we're ready to receive vaccine as early as Sunday, and it may come at any time. Now, we won't distribute it right away. We have to wait for the actual emergency use authorization to come through from the federal government. But they wanted the doses pre-positioned and ready to roll out as soon as the state gives the go signal. And what I was told this week is that Pfizer expects to file for the emergency use the 3rd week of November, which is Thanksgiving week. And they do expect it to be turned around quickly. And assuming that it gets the go-ahead, I think we could be rolling out that vaccine to the targeted groups as early as the following week, November the 30th. And we're still working out now how to do that. We want to get as high adoption rate in the targeted groups as we can. I think as we all know and have read or looked into or even heard directly from people, there's a certain amount of vaccine hesitancy, people concerned about the safety and, was this too rushed and all of that. And I'm here to say I actually qualify, I think, because of my work in long-term care facilities, and I will take the first dose administered in this county if I can manage it. And we will do it very publicly because I have no concerns about it. I've been watching all this for a long time, and I just think there's no reason not to do it, and I'm going to lead the way, and hopefully that will give the people who know me or the people who watch us a little bit more confidence that we're willing to put our money where our mouths where the money is, or what's the saying? Our money where our mouths are. And so that's kind of the plan on vaccine. Now, when will it be available? Well, we know that we'll need a second shipment of probably the same amount in order to be able to do the second shot. There's a booster that's required in 3 weeks from the first shot. So this will be a 6 weeks process to kind of get the first wave of people vaccinated. Now this is being done through hospitals because the health systems are, the public health authorities have all their bandwidth tied up with testing and contact tracing and trying to manage their own other vaccination clinics for flu and childhood vaccinations and so forth. So the State Department of Health decided this very first partial phase, it's called phase 1A, will be done through hospitals, and we're very excited and pleased to be able to participate in that and make a contribution. And so we're setting that up. I think later phases are going to be managed more, possibly through the health departments and through the sort of the normal vaccination supply chain, certainly through hospitals and maybe doctors' offices, but probably through the commercial pharmacy chains that will make themselves capable of storing and managing the thawing process and so forth. Now there is a little bit of confusion that's out there about the long-term care facilities. Some folks who work in long-term care facilities don't realize that the hospitals are supposed to immunize the staff. They think that their companies are arranging it through CVS or Walgreens, which are the two main commercial pharmacy chains that are going to be involved in vaccinations. So with the way the state has split this up is that staff are going to be immunized by the hospitals. The residents of the long-term care facilities are going to be immunized by CVS or Walgreens, whichever one the facility has made a partnership with. So it's confusing to people that within a long-term care facility this is split up. You know, somebody's responsible for one piece, somebody else for the other. And there's a good bit of confusion out there about that. But this is the fact of the matter, as I'm telling you now. As it stands today, the plan is for CVS or Walmart or Walgreens to send teams around to vaccinate residents, and the hospitals will do that for the staff.
You know, just to amplify on the remarks of Dr. Huth, I think all of us were amazed at the fact that this vaccine was 90% effective. And what this means is, the World Health Organization, or the FDA, said they would accept a vaccine that was 50% effective. Well, a vaccine that's 90% effective, that's going to change how we have to conduct ourselves. If you've got a vaccine that's 50% effective, you're going to be reluctant to take your mask off around other people because your mask and distancing are 100%. And then another thought I had while you were talking, Dr. Huth, was somebody asked one of these pharmaceutical officials, what is the normal time that it takes to get emergency release of a medication like this? They said, well, normally it takes about 2 months, but I think it will take 5 or 10 minutes in this instance.
Yeah.
And then the third thing I had to add, which is kind of a human interest aspect to this, is that vaccine was pretty much the brainchild of 2 Turkish physicians who live in Germany and started a company called BioNTech. And they're a married couple, and the husband is this Turkish fellow is a good friend of the CEO of Pfizer, who's a Greek. And typically there's an animosity between Turks and Greeks, but these two are fast friends. But they needed each other. The German company were just doing basic science. They didn't have any way to conduct all these trials that were going to be needed in order to bring the drug forth. So it's been a great partnership between those 2 companies. And I think it will be a very safe vaccine. And I think Dr. Hughes will come through this initial vaccination in fine fettle.
You know, I have so far. I've been in the business over 35 years, and I've never not taken the flu shot. And somehow I've always managed.
Yeah.
I think I will this time too.
And you know, the flu shot, oftentimes, I take the flu shot every year, but sometimes its efficacy is only about 25% in some years. Even though it does, if you do get the flu, your symptoms are much less. So don't everybody get their flu shot, in spite of what I just said. But 90%, I mean, that's, I'm gobsmacked when I hear that it's going to be that effective.
You're watching Ask the Doctors on WGTV Channel 11. We're taking your questions on Facebook or on Twitter at WCTV Info. We're over halfway through the show. Let's grab some questions and see if we can get some answers from these gentlemen. If someone has had COVID-19, there would be some level of antibodies in their blood. Would there be any reaction if they receive the vaccine? Could it give them a greater or longer coverage?
I don't think there's a problem with giving the vaccine to someone who's already had COVID-19. In fact, we asked that question specifically to Dr. Weaver, the Chief Medical Officer for the State Department of Health, and she said there's no reason not to give it to people who have had COVID-19. In fact, we should give it to people who have already had COVID-19. I think there was a concern with natural infection that there's varying degrees of antibody production when there's a natural infection, depending on how severe the infection was and the immune competence of the person. These vaccines will be much more targeted and produce a much more consistent level of antibodies. And I think when you realize that we give 2 shots, an initial and a booster, you know, you think about it, there's some antibody response. There's a response to the immune system from the first shot, yet we're given a second shot. So pretty obviously, if someone has had COVID-19 previously, there's no problem with giving the shots again. You know what I'm saying?
And as a general rule, a vaccine always creates more immune response or protection to a person than than naturally getting the disease. So that's a good thing.
Let's go with the next question. We're going to try to get through a few here real quick. I contacted the health department about volunteering to help with contact tracing, but was told no, as specific training is required. Please advise what other volunteer things the community might be able to help with. Mm-hmm.
Well, I don't know. I think I don't know about what specific training is required for contact tracing, other than I'm going to have to collaborate with my executive director after I answer this question, which may get me in trouble. But I would think that you would be able to do contact tracing with little to no formal training, other than calling up someone, asking who were their contacts. That's somebody that they spent more than 15 minutes with and closer than 6 feet, and then calling those people up until the cases trail out, and then instructing the people basically to quarantine if they're a contact. There may be, I think that questioner who obviously is a good citizen and wants to do something, I want to hook them up with an opportunity to help. If there is a place in the health department, they might pose a question to our Facebook page, and they might specifically call down to the health department, ask if there's something they could do in terms of answering a phone. There may be some help that they could give us down at the Elder Behrman testing site, answering the phone, doing some clerical work. But they don't be discouraged. You know, ask again or ask further. There may be some place that we can use that help. I don't want to discourage that person. They're obviously a good citizen. I want to encourage them.
And we'll encourage Christine Stinson, if she happens to be watching now or watching this later, you can go on our Facebook page and answer this person also directly. I know Dr. Huth, I think you may have done that on occasion too, also gone back into our Facebook page after the show, answered some questions. Feel free to do that if you happen to be watching. We're going to keep the questions coming. We've gotten a few in since we've started this show. We have a few from last week that we need to get through, so let's keep going. Will there come a time when everyone will be tested?
Well, you know, I mean, there are some situations where you will be tested. Let's say, for instance, you donate blood. They are now testing every blood donation for COVID-19, I am told. And so there's that. And if you have to have if you need to have a medical procedure, these days, pretty much everywhere, the people are being tested prior to having those procedures. So there are some situations where people are going to ask you specifically to get tested, but otherwise, you know, this is a free country. We don't make people do things that they don't want to do typically, and you know, you have the ability to go get tested today if you want to be, and you know, so I think people ought to still take advantage of that. I know that the test center's been fairly busy lately, but you know, it's you know, I look at the idea of just anybody testing is that we know that there's a certain degree of asymptomatic carriage of the virus, and it's just worthwhile knowing if you're one of those people, because if you're trying to do the right thing and protect people who are vulnerable, you know, it's worthwhile knowing if I'm positive so that I can take steps to avoid passing that on to somebody who can ill afford to have it. That's why I get tested virtually every week at least. I do work with the vulnerable elderly, and I want to do everything I can to make sure that I'm not in a position to accidentally make one of those individuals sick. So, you know, I think people should continue to take advantage of the testing that we have. It's sure is a different world than it was in the spring when we had hardly any testing, and people wanted to be tested, but we just didn't have a way to get it done. Things are the reverse now, and there's plenty of testing, and we need to continue to utilize those opportunities, which can be done at the Elder Bierman building and also in Cambridge City still with the Optum Serve site, which will be around for another month or more. I'm not sure the exact end date currently, but you know, I guess there's not much more to say about it than that.
Well, there'll finally come a point, I hope, that you know, the pandemic will trail off, and there won't be a reason to be tested except for the specific reasons you mentioned, donating blood, something of that nature. But I have to echo what Dr. Huth has said. I never want to discourage anybody from getting tested. I think the more testing, the better. Even if it's negative, it gives us some idea about the level of virus in our population. And from those numbers, we make decisions.
Mm-hmm.
Just as a note, that testing is available Monday through Friday, 8 a.m. to 6 p.m. at the old Elder Bierman site, and also in Cambridge City, 138 West Main are the locations where you can get that done. And that 138 West Main Street in Cambridge City is open Monday through Friday from 8 a.m. to 8 p.m. At the Elder Bierman building, it is 8 a.m. to 6 p.m. And that Elder Bierman site is being run by the Wayne County Health Department. I'm told the next question is a little bit long, so hopefully we'll go through this and you all can help me with any words and things that I stumble over. So here we go. I've read in a few places that Reed is at capacity for ICU beds. When I go to the indiana.gov site, it says we have 19.6% availability, which looks like about 31 ICU beds.
Well, no, Reed has 30 ICU beds in total, and the numbers of occupied ICU beds have varied up and down a little bit over the last few weeks, because we don't keep people there any longer than we really need to have them in there. And I think this morning we had 24 patients in ICU beds, which is about 83%, I think if you did the math on it, 83% of the capacity of the ICU. And that's about what we've been running for the last few weeks. In my mind, I break it down that the capacity issue, it's not just of all the beds in Reed, how many are occupied, how many are not, because we have some beds that are dedicated for things that are not germane to the discussion. We've got beds for labor and delivery. We've got beds for psychiatry and geriatric psychiatry and some other sort of specialized purposes. So when I think about the capacity, I put it into two parts. It's the capacity utilization of the ICU beds. I've mentioned that number already. We've been in the 80-85% range, but on some days this has been as completely full for short periods of time. And then on the other hand, there's what I would call the general medical surgical beds, which is where we would put the normal cases that people come in with emergency care, the appendectomies, the pneumonias, the heart attacks, the strokes, the whatever, and then also the COVID-19 patients. It's those two capacities that really kind of drive our capabilities to manage the general medical care of the community. And we've been consistently using about 90 to 95% of the capacity of the medical surgical beds. And that results in only about 5 med-surg beds being available. In the ICU, it's about 5 or 6 beds available. So when we have those few of beds available, those numbers are just numbers, and so you have to have some context to understand them, what the import of that is. We in pre-COVID times, in normal days, new admissions from ICU and referrals and that kind, and post-op care would be about 30 to 40 admissions a day on average. Since we've had this latest surge in COVID-19, the total admissions a day have been consistently in the 60 to 80 range. So basically doubled. So I have 5 med-surg beds, about 5 ICU beds at any given moment lately. How am I supposed to squeeze 70 people into that? So that's where we have to get very creative, move people around, create additional space, get people out faster. But those, when we're talking about moving individual patients to other levels of care, that's a very one-on-one, situation that's very individualized to their needs. And sometimes we're successful at moving those, sometimes not. And so it's a very arduous process to go through. And that's where we're at today. So just that ratio of 70 admissions a day, 5 available beds, you can see that the math doesn't work.
Okay. I think another thing to point out is how fluid the situation is. And those numbers on the Indiana State Department of Health site are reported once a day, whereas we're doing this during that 24-hour cycle.
You're watching Ask the Doctors on WGTV Channel 11, also streaming on Facebook Live. Also thanks to TV3 in Connorsville for taking and airing this program. Since we're talking numbers and we don't want to boil it down to that, those numbers are actual people, let's go through some of your numbers for this week that you provided to us. If we can, Steve, if you can bring up those slides. We've got Steve Bonwig doing the directing, the person in my ear, getting some assistance today from Michelle Thompson, so thank you both very much. First slide up.
These are the Wayne County numbers. I keep a specialized version of this statistic to share in various ways, and Christine has a much more robust set of metrics. But we can see that in the week ended last Saturday, the 7th, there were 315 cases roughly, and that compared to 354 from the week before. So far this week, the last bar, which I've colored differently because it's the week in progress, there have been 254. That's an average of around 5 a day. There are 2 more reporting days left in the week for that. So if we continue at the same rate, the week should end up at about the same as last week, a little over 300. that would be down from a couple weeks ago, which would be good. And I think the feeling I get from talking to Christine, it's kind of on a day-to-day basis. Sometimes there's an explosion on a given day. This past week, a couple days have been kind of very high, but also there have been some days where they have seemed relatively low. Maybe we're getting a little bit of a break, but I don't think we're ready to call that exactly. We need to see more time periods to be able to say whether the trend has changed. Go on to the next one, Stephen or Michelle. And so working from the new cases, these are the trends over time of the age groupings. And, you know, this graph is evolving as we get more cases, but we still see kind of the same pattern where we've had a significant increase in the two oldest age groups at 70, the 70s and in the 80 plus. And so that those two age groups together are pretty consistently about 20% of the cases lately. Now, I've also got the 50 to 59 age group mark because a lot of people look at this graph and notice that. And I've mentioned this once to some folks from the State Department of Health, and they agreed with my thought that what that represents is there are the people who are getting admitted to the hospital with severe complications in the oldest age groups kind of come from two contexts. One is long-term care patients, and we are still seeing a few of those. But then there are also people who come from the community. But in the very oldest age groups, those people in the community are being cared for by others, typically family members, and often in that 50 to 59 age group. So we can see that they're sort of cross-contaminating, and honestly, what it more likely is, the younger is spreading to the older because the olders are less likely to be out and about unprotected. Not always the case, but certainly true. Now, you have to remember this graph with the last two sets of bars of the 20% of cases being over age 70. Got to keep that in mind for the next bit, if you'll switch on there, Stephen or Michelle. And these are the comparison of deaths before October the 1st were 15, and then how has it been since we had the beginning of this current surge, beginning about the 1st of October? Well, knowing that 20% of the cases are over age 70, and also knowing that you can estimate the case fatality rates in those age groups just by looking at the state website. They don't report case fatality rates directly, but you can actually calculate it. And that's what I've done, and then apply that to the cases that we have, and we can see that in the middle bar, we should have, for the cases since October 1st, we should expect to have about 40 deaths altogether on the cases so far. The black bar on the right is the actual cases that we have had since October 1st, and that is 30 so far. And that includes the new one from yesterday. So I think what we need to take away from this is just the stark reality that when we have a lot of spread in the community, it's not a small thing. I know a lot of younger people don't have a lot of symptoms and aren't as likely to wind up in the hospital, but I will say we have one young person under the age of 40 who's in the hospital right now on a ventilator. So it's not impossible, but the burden of this disease is far and away on the oldest age groups. And the way those elders get sick is because younger, less symptomatic folks or asymptomatic folks have unwittingly spread it to them. So we've got to take responsibility for that as individuals. And I need to protect myself so that I'm not a hazard to somebody who can ill afford to acquire this disease. If you want to go back to the slides there should be one more, and that's the reads volumes, just so you can have a visual on what's been happening there lately. And you can see that, and this is the average each week. The last set is for this current week that will end Saturday, tomorrow. So far this week, we've averaged 70 patients in containment areas, 50 known positives, And those numbers are 50% higher, up to 50% higher than, or on average are 50% higher than we had at any point prior in the epidemic. The last little bar are the patients on ventilators. We've averaged 5 a day this week. We had 6 this morning, actually. And very fortunately, that's the one thing that has not increased proportionately to the increase in cases, so we can at least be thankful for that little silver lining. But people are getting sick enough to be on ventilators, and as I say, we've got 6 this morning. And that's a very sad situation, and I mentioned there was a younger person among them.
We've got about 8 minutes left. We've got a number of questions backed up that we're going to try to get through, so I'm going to say bring your answers down to a little bit more of the sound bite if we can. How do you explain high percentages of cases in 20 to 29 and 50 to 59? You went through a little bit of this. Is it because of their lack of mask compliance?
I think that may be more true in the younger age group. I think there's a couple of factors that make people not wear a mask. I think a lot of people just have COVID fatigue. They're tired of social distancing and wearing a mask. And I think when the governor went to stage 5, a lot of people incorrectly assumed that it was over. The worst is behind us. It's clear sailing ahead. And then I think that coupled with the knowledge that that particular age, 20 to 29-year-olds, this is includes single people and people that are much more socially active, and people who don't suffer as much from the disease as people in the 7th and 8th decade of their lives, 6th decade of their lives. So I think that's, these are all suppositions, obviously, but I mean, that's my take on it. Do you have anything to add, Dr. Hughes?
No, I think that's right. I guess to me, just common sense tells me that in the younger groups, the 20 to 29, there probably is a lot of not taking precautions because there's not a perception of personal risk in that. In the 50 to 59, there's probably some of that, but I think but there's probably a higher proportion in that age group of people taking precautions generally, but letting people into their bubble who are not.
Next question. Has there been any more updates on what it means to have COVID-19 antibodies?
Very quickly, the assumption is that if you had a COVID-19 and you have neutralizing antibodies, you are probably protected for at least 3 months. But we know from that natural infection, the antibody levels tend to wane fairly quickly. We think vaccination will achieve higher levels and last longer.
Is it sounding like this vaccine, even after we get it, is going to end up being a yearly type of thing? Is there any way to tell that right now?
I think many people, myself included, surmise that it may be. I mean, many people think that COVID will be a recurrent infection, just like the common flu that we get a shot for. On the other hand, there's cases when a coronavirus has just kind of disappeared basically from the face of the earth, like they're just, I think, remnants of SARS in the Arabian Peninsula. MERS, I think, has kind of disappeared. So the short answer, Eric, is no one knows for sure what will happen. It may become a recurrent disease that we would get a shot for every fall like we do our regular flu shot. So, but that's what I think will happen. What are your thoughts, Dr.
Yeah, I
Hughes?
agree. I think that there's a possibility that either coronavirus won't go away in its current form and we need to get re-immunized periodically, kind of like you do on a much longer time scale for tetanus. But the other issue is if the virus mutates significantly, then there may need to be new versions of vaccine. That would be much more analogous to what we have with flu. And I've heard people speculate that maybe the flu shot will be, in the future, a combined influenza and COVID vaccine.
3.5 minutes left. I'm told we have a short question, so we'll see if we can get some short answers. Is there a specific contact tracing phone number we should be aware of for contact tracing?
I would simply call the Department of Health. If you're somebody that is tested positive for COVID, I'd call the Department of Health. If you want advice regarding if you think you may have been a contact and you want advice on how to proceed, then I would call the Department of Public Health.
Okay. I'm going to put you on the spot real quick. I know there was a question last week about the potential for drive-through flu clinics. You mentioned you were going to try to check on that.
Yeah, well, we've had 4, regional flu clinics in the county, and we had talked about that earlier. We bought a mobile van. We talked about driving that van out to give flu shots in the county, but well, you've seen the graphs that Dr. Youth has shown. This is, we've got a finite amount of manpower, just like Reed Hospital has at the Public Health Department, and almost all of our resources are being, even with the help of the National Guard, is being driven by testing and contact tracing for the pandemic. If this changes, we may have drive-through flu clinic, but right now you can get a flu shot at the Elder Bierman site from 8 to 6, Monday through Friday. Just come to that south entrance.
Okay. Dr. David Jetmore, Wayne County Health Officer. Dr. Thomas Huth, Vice President of Medical Affairs at Reed Health, also a guest on WHIO's Wednesday 5 p.m. newscast. Find him in various places, Twitter,
I'll be there
LinkedIn.
again today at 5, by the way.
I'm sorry?
Today I'll be there at 5 as well.
Ah, okay. A special Friday edition. Nice. Thank you very much, gentlemen. See you again next Friday, 2 p.m.
Thanks for having us, Eric.
Reminder, testing is available if you're looking to get tested Monday through Friday, 8 a.m. to 6 p.m. The old Elder Bierman site. There's some information that's going to come up on the screen if you don't have an appointment or if you want to do some scheduling. Very easy to do. Just kind of follow those instructions. Obviously, this will be up on Facebook, so you can pause it later and watch. Also, 138 West Main Street in Cambridge City, Monday through Friday, 8 a.m. to 8 p.m. Free COVID screening, 7 a.m. to 6 p.m. 7 days a week through the Reed Health Now app with virtual visits, reedhealthnow.org. And the Indiana Department of Workforce Development has created a landing page for all information on COVID-19 as it relates to workforce and unemployment insurance. There is information there on the screen that will take you through that. Thank you very much for watching this week's Ask the Doctors on Whitewater Community Television's WGTV Channel 11. Happy birthday. Thank you very much for watching. I wish you well. Have a safe weekend.